On behalf of Precision Health, I'd like to welcome you to our new geocoding tutorial. Geocoding an address is the process of determining a precise latitude and longitude location for that address. The Precision Health team has been working to bring this enhancement into being as one of its resources, and today we will walk through what it is and how to access it. I am joined by Mr. Adrian Waring, who's a lead application programmer who has over 20 years of experience building complex software applications, and Dr. Linda Lisbeth, who's a professor of epidemiology at the University of Michigan School of Public Health. The first question is for Linda. Geolocation sounds like an exciting enhancement to precision health data. Can you provide an overview of the Precision Health Geolocation project?
Sure, thank you, Vicki. We have geocoded the history of Michigan medicine patient addresses going back all the way to the year 2000. We have geocoded over 2.3 million current patient addresses within the states of Michigan, Ohio, and Indiana, as well as another 3.9 million historical addresses. The geocoding success rate for our current addresses is over 95%, which is excellent. In other words, we have precise location data for 95% of our patients' current addresses. The geocoding success rate for all addresses, including both the current and historical addresses, is 91%. Once an address has been geocoded, we are then able to identify its respective census blocks and census tract identifiers, which enables us to join those patient addresses with a number of neighborhood and location-based data sets.
Adrian, the next question is for you. Exactly what type of location data is available?
So obviously we have the latitude and longitude data along with the U.S. Census block and tract identifiers. And we have those for all of the addresses that are geocoded successfully. And, we use this to join patient addresses with data sets from the National Neighborhood Data Archive, or what we refer to as NANDA. The NANDA data sets we currently offer include neighborhood socioeconomic metrics, walkability, crime, land use, libraries, fast food, climate, healthcare, housing, and public transit availability. We also use the geolocation data in our self-service DataDirect application. Once a DataDirect user has identified a cohort of patients, we use NANDA data to build a socioeconomic overview report specific to that cohort. Lastly, our most recent geocoding enhancement project provides a year-by-year breakdown of active addresses for each patient going back to the year 2000. So pulling a patient's respective address for a target year is simple, as is viewing a continuous history of addresses for each patient.
As a follow-up question, then, what does the geolocation resource not include?
Well, right now it's limited to patients living in Michigan, Ohio, and Indiana. Those are the only addresses we've geocoded. And also, there are a certain number of addresses that just don't successfully geocode. Sometimes this is due to data entry errors with the addresses themselves, but sometimes it's because either a street name or a house number just simply doesn't exist in our underlying geocoding database, and we can't determine with confidence where exactly that house is.
I'm sure then there's some quality assurances. So what sort of quality assurance approaches were used to ensure the accuracy of the data?
Well, we did a few different things. So the geocoder itself is tested using many thousands, tens of thousands of public available addresses and location data sets. So we did that with the publicly available addresses that we sort of had known results for. So that was the initial testing of it. We also run sanity checks to verify that our generated coordinates lie within known municipality and zip code boundaries. And lastly, we do a spot check just of random addresses after each geocoder update.
I know very shortly we're going to be looking at some of the data, and I just wanted to clarify, given the fact that addresses are identifiable information and can be very sensitive information for a lot of people, what procedures are in place to protect the data and what format can investigators expect to get their results in?
So the geocoded data really is like any other PHI data. It falls under the IRB approval process. So it's really part of that whole process. It's not just data that's out there to be publicly viewed by anybody. Once a researcher has gotten approval to see data, then we generally deliver this raw data in a CSV formatted file onto a secure computing environment that the researcher has access to.
Okay, so let's take a look at what a report may look like in Data Direct using this National Neighborhood Data Archive. So if you are interested in a particular patient population, you can subset on that population. This example includes the subset of patients who are COVID positive, for example. The report will tell you how many patients are in that data pool and how many were successfully geocoded using the patient address. It will also provide you with some basic summary information about the neighborhood characteristics for that patient population. For example, it will provide you with the distribution of the neighborhood disadvantage index across the neighborhoods that those patients reside in. This is an example here in this first figure. The neighborhood disadvantage index ranges from 0 to 1, with higher values representing greater disadvantage. So you can look at this for your patient population of interest and also make comparisons with Michigan, Washtenaw County, for example, so that you can understand the unique characteristics of your population. So the different summary characteristics include neighborhood disadvantage, neighborhood affluence, a measure of the educational levels across the neighborhoods, as well as a measure of the neighborhood ethnic immigrant concentration. So this just gives you a nice snapshot of what those characteristics look like for the population of interest.
So this next question is for Linda. What types of research do you anticipate will be improved with the availability of this data? And do you have an example of projects that you can talk about?
Sure. I think there are numerous possibilities for using this rich geographic or location-based data. For example, the new data includes measures of socioeconomic status, as Adrian mentioned, that are critical determinants of population health and now can be accounted for in clinical genetic and epidemiologic studies using the precision health data. For example, a neighborhood socioeconomic disadvantage index was used to account for socioeconomic status in a recently published paper investigating racial and ethnic differences in COVID-19 outcomes in the Michigan medicine population. Further, the new data, including measures of socioeconomic disadvantage and affluence and other measures of the neighborhood environment, may be considered as exposures or risk factors themselves in future studies, or could be used to consider the impact of gene-environment interactions on various health outcomes. I think there are many more possibilities for using this data in future research, but that gives you a quick snapshot.
That is really amazing, and this sounds like an incredible resource for our investigators. Are there plans to expand the geolocation data in the precision health? And if so, at what pace and in what priority?
Yeah, again, I think there are numerous possibilities, but geocoding the complete patient address history, given the volume, was a big project that we just recently finished. Our near-term goal is to help researchers acquire relevant location-based data for their respective projects. So really get this data out there and being used for research, and to better understand which future enhancements might provide the most value to our research users.
Great. Is there a way where if someone is interested in getting some more information or learning more about these resources or how they can access the data, is there a place that you would recommend they would go?
Yes, the Precision Health website is a great resource for information about all of the precision health tools and resources. The website address is precisionhealth.umich.edu. Another way to get information is to email us at phdatahelp@umich.edu, and you should receive a response quickly to get the assistance that you need.
Great. Thank you both so much for your time today and for all the effort that you put into creating this resource for our researchers.
Well, thank you.
Thank you.